Hi, my name is Caitlin Martin. I'm at Virginia Commonwealth University in Richmond, Virginia. The title of our study is Disparities in Opioid Use Disorder-Related Hospital Use Among Postpartum Virginia Medicaid Members. We all know that the pregnancy and postpartum periods are extremely high risk for people who have the disease of addiction. Regarding opioid use disorder, overdose-related deaths and other morbidity and mortality related to opioid use disorder is quite prevalent in the pregnancy and postpartum periods. Data from other states have indicated that the latter postpartum periods, especially between 6 and 12 months, are the times of greatest risk. Other data from other states and other national data concerning mental health conditions and their morbidity and mortality in the pregnancy and postpartum periods also indicate that there's grave disparities that exist by race, ethnicity, and other social determinants of health. What we set out to do was to identify the prevalence of opioid use disorder-related morbidity and mortality in our state of Virginia among Medicaid members during pregnancy through the 1-year postpartum period, which we know is the highest risk according to data from other states. In doing so, though, we ended up discovering grave and stark racial disparities in morbidity and mortality between Black and white members of Virginia Medicaid, especially in the postpartum period. So we focused on the postpartum period, and we also wanted to identify the prevalence of morbidity and mortality within race, so within white Medicaid members and within Black Medicaid members, as well as to identify the roles secondarily that treatment may play in reducing this risk of morbidity and mortality through the really vulnerable postpartum period. So using a retrospective cohort study of Virginia Medicaid's data, using the most recent data that we had available preceding the COVID-19 pandemic between 2016 and 2019, we identified over 96,000 deliveries by Black and white non-Hispanic birthing parents. 2.5% of those parents had evidence of opioid use disorder. And we specifically looked at the members who had opioid use disorder and also had a live delivery during this time frame. And we looked at the prevalence of opioid use disorder related acute hospital use, which is a main marker of morbidity and mortality among these Virginia Medicaid members related to opioid use disorder. We didn't have access to fatal overdoses, but this does include non-fatal overdoses notably. And what we found generally is that the prevalence of this opioid use disorder related morbidity marked by this acute hospital use in the postpartum period was extremely more prevalent among our Black birthing parents than our white birthing parents in the postpartum period at 16.5% versus 9% for our white non-Hispanic birthing parents. In our multivariate regression, where we included other sociodemographic variables that we had available to us in the data set, what we really found was that having a diagnosis of opioid use disorder was related with 11 times the odds of having this marker of opioid use disorder related morbidity in the postpartum period when we race stratified within the Black birthing parents versus double the odds among the white birthing parents, really highlighting the importance of looking within these communities of color and looking at how we can advance the health and how can we advance equity when we're thinking about how to include treatments and other interventions for this disease of addiction.